Welcome back to Pharmacology Decoded by RK. In today's video, we will understand one of the most important drug mechanism in pharmacology, the mechanism of non-steroidal anti-inflammatory drugs or NSAIDs. Let's decode it in a simple and visual way. Non-steroidal anti-inflammatory drugs are a class of drugs that reduce pain, fever, and inflammation. They are among the most commonly used drugs worldwide. Think of aspirin, diclofenac, and celecoxib. But how do they work? Let's look at their mechanism step by step. Everything begins with a membrane phospholipids. When our body tissues are damaged, these phospholipids release a compound which is called as arachidonic acid, the key molecule in inflammation. Now this arachidonic acid is converted into prostaglandins by an enzymes called cyclooxygenase or COX enzymes. The COX-1 is constitutive, it's always active and helps in gastrointestinal protection and platelet activation. COX-2 is inducible, it is activated during inflammation, pain and fever. Actually, the COX enzymes are available in two isoforms. One is COX-1, another one is COX-2. Non-steroidal anti-inflammatory drugs working by inhibiting COX enzymes, thereby blocking the prostaglandin synthesis. Drugs like aspirin mainly inhibit COX-1, so while they relieve pain and fever, they may also reduce stomach protection. That's why gastric irritation can occur. Drugs like Diclofenac and Aceclofenac providing COX-2 anti-inflammatory actions with less gastric irritation. Finally, selective COX-2 inhibitors like Celecoxib and Etoricoxib specifically target the COX-2 enzymes, giving an anti-inflammatory as well as analgesic effects with minimal gastrointestinal side effects. So, in short, COX-1 inhibition decrease the gastrointestinal production and platelet activation, and COX-2 inhibition reduce pain, fever, as well as inflammation. So, that's the core mechanism of non-steroidal anti-inflammatory drugs. So, the non-steroidal inflammatory drugs, aspirin, can able to inhibit COX-1 as well as COX-2 because it is a non-selective, and preferential COX-2 inhibitors, preferably it will inhibit COX-2 comparatively with the COX-1, but the selective COX-2 inhibitors only select the COX-2. I hope this visual breakdown helped you understand how non-steroidal inflammatory drugs work. If you found this useful video, don't forget to like, share, and subscribe to Pharmacology Decoded by RK for more easy pharmacology.